Hello everyone, welcome to Sunya IAS and welcome to this lecture. In this lecture, we are going to talk about a very important and in fact a very touching topic, that is mental health. And I think every UPSC aspirant would somewhat be aware of this particular topic. But we will study this from the perspective of our examination, of course. And in this journey, before we start this particular class, let me just address this, that in this journey it can be difficult to sustain for a very long period of time because of such heavy studies that you have to do, then lack of friends and everything. So mental health का जब आप topic पढ़ोगे, just read it with a lot of passion. Of course, don't get too much into it that आप research करने निकल पड़ो इस पर, but read it with a lot of passion and read it with the awareness that government is actually now focusing on mental health, because the repercussions of not focusing on mental health are now coming forward, right? The biggest of celebrities, from the biggest of celebrities to students in quota, there are people who are committing suicides, and we are losing about 1 lakh people every year to suicides, from a poor farmer to the owner of cafe coffee day, right? So that's why mental health is now a part of the overall health discourse of our country, which is a very good thing. Okay, so with this aspect and after addressing this, let's just go forward with how we will handle this. Now, how will you get the notes of this class? Let me just address this first. You can get the notes in two ways. Two ways. One, you can make handwritten notes out of it while the class is going on. It is very nicely organized, so you'll be able to make handwritten notes. But with the handwritten notes, you have to be very careful that you need to organize them in a manner that you can revise them again and again. Okay, that is your responsibility. Or you can go for the Sunya IAS books, GS books. Okay. So for example, the mental health topic which we are going to do today, you will find it in your GS2 book, health section, right? So this is about the notes. So people ask about the PDF of the lecture. PDF won't be available separately. Either you make handwritten notes or you straight away order the book, whichever is more suitable for you. Okay. Now let's start with the mental health. We'll start with some important data which you will not use in a question for mental health directly like this. Like, you will not make a circle and write 4 data pointers. You will always write data with the pointers, that why focusing on mental health is important. Because we are having these many suicides, because there is so much of hidden illness related to mental health. That is how you will use it. So let's go one by one. First of all, as I already told you, WHO data suggests that there are about 1 lakh suicides per year in India, which is a huge number. It is an absolutely huge number. And this 1 lakh is limited to the 15 to 29 years. 15 to 29 years category, right? In fact, suicide is the biggest killer of this particular age. See, because when you are elder, right? Elder in the sense when you are in the, let's say 40s or 50s, in that way, the chances of you being, falling ill to a particular disease are more than the suicide aspect of it, right? Because you have family and everything. But this is a very sensitive age. 15 to 29 is a very, very sensitive age, and suicide has come up as the biggest killer of this particular age group, which is actually very, very problematic. Okay. Then WHO data also talks about, in fact, there is this mental health statistics which talks about the fact that there are about 800 million people who are affected by mental health globally. So if we talk about global data, there are 800 million people who are affected by mental health, and these are just the numbers that have come to light. So somewhere or the other, these people have come out and said that we are affected by mental health. They might have gone to a psychiatrist, they might have gone to take therapy or anything, but they have come out. There are so many people who are not even aware of the fact that they are having mental health issues, but they are having. So the actual number would be much more than this 800 million, but this is something that is there. Then when we talk about India, the NIMHANS database. Now, what is NIMHANS? National Institute for Mental Health and Neurosciences. That is NIMHANS. Okay. So, NIMHANS database tells us that about 80% people who need mental health assistance in India, this is India specific, okay. 80% people who need mental health assistance do not get mental health assistance. Do not get mental health assistance. This is India specific. So just imagine, out of every 10 people who may be depressed or maybe bipolar or maybe suffering from ADHD or any kind of mental illness, schizophrenia, anything, 8 out of 10 people are not even having access. They don't know where to go. And I think because the topic about mental health is so much, has been so talked about on social media nowadays, you would be seeing people saying that, therapy is very expensive or a psychiatrist is very expensive. You don't decide to go to a doctor when you are feeling ill, right? But because mental health is not considered an illness as such in India, that is why going to a psychologist or a therapist or a psychiatrist is an option. And that is why 8 out of 10 people are actually not aware also where to go and how to gain that access. Then overall, when we talk about Indians, according to WHO again, there are about 45 million Indians. This is not global. 45 million Indians who suffer from depression. Okay. And most of them will not even recognize that depression is an actual illness which can impact your physical activity as well. And this is 45 million Indians being affected from depression, and 45 million Indians actually are affected by anxiety. You corroborate these statistics with the World Happiness Index and these kind of indexes, and you will see that they come out to be true in some way or the other, because people are not talking about their mental health, and that is a big issue, and that is why this data is so important. Another very disturbing data is that when you talk about psychiatrists, there is not even one psychiatrist for every 1 lakh people in our country. Yes, there are 0.75 psychiatrists for every 1 lakh people in our country. This is our data. Not even one psychiatrist for every 1 lakh of our population, right? And even then, people are not very keen to go into psychotherapy and even psychology, because these professions are not considered well paid in India. But if you want to practice these in developed countries, they are actually very well respected, and that is why they are very well talked about also, and they are proper provisions. They are proper career options. Like आज की डेट में अगर आप किसी को बोलो I want to be a psychiatrist, they will keep on asking you that do you need a psychiatrist? Why are you wanting to be a psychiatrist? वैसा वाला हिसाब है, right? Then how much do we actually spend on mental health? We do know that we spend about somewhere about 2.1% on our health care, but how much of that is actually on mental health? You will be surprised to know that it is 0.05% of our GDP. 0.05% of our GDP, not 0.5%. That would be huge. 0.05% of our GDP and 1% of our expenditure on health. So, the amount of money that we are spending on health, only 1% of that is going into mental health, and overall 0.05% of total GDP is going into mental health, despite us knowing that it is actually it is actually an epidemic and a pandemic that is now spreading, because during COVID-19 we came to know a lot about mental health, and that is why Indian government has also stepped up its efforts to go into mental health, right? So that is there. So these are some data points, and these data points you can directly use as issues also, that there are high suicides, there are less number of psychiatrists, there is less resource that is being given to the mental health aspect of it. So every data point is an issue in itself. I hope you understand. We will still cover the issues, but what I'm trying to say is that even data pointers you can use as issues as such. Now, this aspect, why are mental health issues increasing? Why is there increase? See, first, there are two schools of thought. One is that mental health issues are increasing. Okay. The second is that now more people are talking about it, right? So, second is that awareness is increasing. And the people are very much divided on this, that either it can be the awareness that is increasing or it can be the illness that is increasing. See, it is a mix of both of them. Please understand. The issues are definitely increasing because of the reasons that we will talk about. It is the digital age, it is isolation, there's a lot of competition, we'll talk about it. But the awareness is also a part. Like, for example, I'll tell you about it. Delhi being called the rape capital. I'll give you an example. Delhi being called the rape capital. A big reason for that is also because the reporting that is done in Delhi is pretty high. The policing system, the registration system of Delhi police is pretty strong. So the cases which are coming up to Delhi police are all being registered. There are so many cases which go unregistered in the rural areas, in the suburban areas, right? And there is no accountability over there. So that also plays a part. Of course, Delhi is very risky for women, no doubt about it. But this is also a reason. Similarly, mental health issues are increasing and mental health awareness is also increasing, and both the things are contributing to more and more discussion about mental health. I hope you understand what I'm saying now. Fine. As a UPSC aspirant, never go into binaries. Always have a very balanced view. Never ever go into the binaries of it. कि या तो ये है या ये है, नहीं, दोनों है. Okay. So, changing lifestyle patterns, of course, you all are aware of this. We are developing more of sedentary lifestyle. Less physical activity, less, more and more digital time, and I think it is universal for everyone, right? So sedentary lifestyle leads to being more prone to depression, because your dopamine is not being released and you are actually dependent upon these likes and comments and whatnot for dopamine release. Then career driven mindset of parents. Now don't write this point in your paper because it will look a little kiddish, but this is for your understanding that the traditional families that we have, they are two kinds of families. One is that they are pressurizing, or they want their child to be successful, so they are not understanding that it can impact the mental health, and people are being pushed into medical, people are being pushed into engineering, some of you might also be pushed into the UPSC preparation, right? One is that people who want to study are not being given that opportunity to study. So any which way, the family influences a lot of mental health issues. It's not that family causes a lot of mental health issues intentionally. It's not like that. But yes, due to lack of awareness, even at the level of family, there are a lot of issues that stem up. Then stigma and discrimination, of course, and these pointers you can use as it is. Okay, you do not have to explain them also. If you write stigma and discrimination, It will be self-explanatory that yes, in our society, mental health is not being talked about. Okay. So as I told you that if you want to be a psychiatrist, you will be asked that do you want to go to a psychiatrist? Do you need a psychiatrist? Because why would you want to be a psychiatrist otherwise? Okay, similarly, if you tell your parents or if you tell your family or if you tell even your friends that, I think I need to take therapy, it's not very well received even today, right? Then, extensive use of digital gadgets is actually proven to have these kind of, right now also you are watching this video on a digital gadget and you might be thinking about some of the mental health issues that you might be facing, right? Mental health issues and mental disease, mental illness are two different things. Okay, you can have health issues like obesity, for example, can be a health issue. But when does it transform into a disease? Right? It is the acute form of not being well. Okay, so every mental health issue is not a mental illness. Understand this. Then social media also, it leads to a lot of body image issues. Many people have entered this UPSC preparation seeing the grand life of an IAS officer, grand life of an IPS officer, you know. So social media has impacted our life choices and made us very consumerist, made us very result oriented, so much so that we have forgotten that even the process has to be enjoyed. Even the process has to be enjoyed. And this is across, okay? Then poverty. This is very important. We think, and it is said that, the mental illness is something that only the elite and the rich suffer from. This is not something that is natural because only the rich ones have the time to be mentally ill. Please understand this, that if a husband is coming drunk every night and is doing wife beating every night or coming home and shouting or any kind of, it is a mental illness. Alcoholism is a mental illness, right? So saying that mental illness is limited only to the elites and the poor people do not suffer from that is the biggest rhetoric that is there, because everyone who is not able to function happily in their life are suffering from some or the other mental health issue for that time or for a permanent period of time, right? So this might have come out as a revelation to you, right? That if a husband is coming home and beating up his wife under the influence of alcohol every night, that is mental illness. That is not normal. Okay. So, even the poor are suffering from mental illness, and poverty actually creates more of mental illness. Okay. That is a problem. Then overall demographic factors are there. So for example, when you are an old person and if you are old and sick and if your children have abandoned you, you are much more prone to mental illness. So demographic factors. Similarly, if you are, for example, a widow and you live in a traditional society wherein and god forbid you are god forbid you are a widow in very recent years of your marriage, unfortunately. So it will be difficult for you to even survive because the death of your husband will be blamed on you. It's the kind of society that is there. So बहुत सारी चीजें होती हैं, but demographic factors are also there, and overall environmental factors are also there. Ours is a hot and humid climate. Okay, hot and humid climate keeps our uh, mental stress high because there is a lot of perspiration, there is a lot of stress in our overall body. So that is why the environmental factors also lead to mental health issues. So these are the reasons why mental health issues have been increasing. Okay, and now let's see why it is difficult to treat mental health issues. Okay, why it has become difficult? Because earlier there was no demand for treating mental health issues, right? Very few people actually knew that there are mental health issues which are existing. So now that this is becoming a common discourse, what are the issues that are there? Okay, biggest thing that I told you, therapy or the appointment of a psychiatrist is considered very expensive. You can give 1,000 rupees for a doctor's appointment who will maybe sit with you for 10 minutes and give you medicines for which you have to give further money. That will be okay. Spending 1,000 rupees for that is okay for you. But if you want to spend 1,000 rupees for a 1 hour conversation with a therapist, you will not be you will not be willing to do that, because you're not getting any tangible benefit out of it according to you, right? So it's high cost. Apparently it looks like it is high cost. Then resources are very few. I told you that we are having just 0.75 per lakh, and the registered psychiatrists in India are just about 9,000. 9,000 in a country of 1.4 billion people is nothing. These are registered, there are very many unregistered, and it is very difficult that mental health issues would actually go to the level of psychiatrists. Mostly they are either handled at the level of home or they are ridiculed at the level of home. So that is why. But just imagine, when the government of India is now taking into account that no, mental health is becoming an epidemic, it's becoming a pandemic, that is the time now we are talking about it, right? Then budget allocation is very low. I have already told you, 1% of the health budget. Hardly 1% of the health budget is going to mental health. And I told you earlier in the health sector video that we are spending approximately 60% on curative health. And within that curative health aspect also, we are not spending much on mental health, and that is a problem. Then overall, there is high burden on the tertiary healthcare sectors, and poor people are definitely not thinking about also and not even going to therapy. Lack of healthcare centers, rise in severity, and disproportionate impact. As I told you, some disproportionate impact on some sectors of the some sections of the society, like the old, like the disabled. Disabled have a lot of mental health issues. If you are physically disabled, you are highly probable to develop mental health issues as well, because you will be isolated from overall experiences of life, because disabled friendly infrastructure is not very well developed in our country, and that is why it will lead to you being on the back front, right? Then policy focus has not been there. Our focus has been on curative aspect. Centralization of welfare has been seen, and overall the mental health asylums which are there, the National Human Rights Commission has come up with reports which has said that there are massive human rights violations that are happening, including sexual violence, including mockery, making mockery out of them. It's so easy to say ki ye to pagal hai, right? But when someone is actually displaying um, some signs of a mental illness and you are actually exploiting them more and more, that is a human rights violation. Okay, so that is there. Socially, of course, there is stigma, there is lack of awareness, there are irrational beliefs also. So for example, I'll tell you, and you must be aware of this also, that being a homosexual has for a very long period of time been considered as a mental health issue. You know, um, when people take the courage to come up to their parents and say that, okay, we are homosexual, or we are lesbian, or we are gay, many times, because of awareness of these things as well, parents end up taking the children to some sort of quacks or some sort of, some black magic things and irrational beliefs. Because of this, these people, the quacks, they keep on getting strengthened, and they claim to have some sort of solution for mental health issues as well. Okay, which is very problematic. Abusive, then nuclear families are increasing, and when you have lesser people, it's a two double-edged sword. If you have lesser people to talk to, it can be helpful for you for some time, but then it can hit you back also, right? Because of loneliness. The elderly are being abandoned. Post treatment gap is there. Even if someone goes to therapy, then there is no mechanism to actually find out that whether that person has recovered or is not recovering, these kind of things. Psychosocial factors, neglected areas, suicidal tendencies are increasing, vulnerability of the ill, and gendered nature. Women are generally considered more emotional and hence um, more and more probable of suffering through mental illness. But again, as I told you, that it's not that men do not suffer from it. Some behaviors of men are actually not classified as mental illness, but some behaviors of men are clearly resembling the mental illness aspect of it. Like I just gave you an example of wife beating or alcoholism for that matter. Now, what is the impact of mental illness? See, impact and issues can seem to be overlapping, but depending on the question that you are being asked, you answer it by giving a subheading of either impact or issues. So you can be asked that what are the issues surrounding mental health in India, or why. If your issues are asked, then you go about the issues. If it is asked, why is mental health gaining importance in public health discourse, okay, that is when you need to write the impact of it. So when a large number of people, like 45 million people as according to WHO, suffering from depression, another 45 suffering from anxiety. So when these many people are suffering from some or the other mental health issues, don't you think the human resources will be impacted? The human resources of our country will be negatively impacted. Those people who could add to the workforce very productively will not be able to add to the workforce productively now. Burden of disease will be increasing. They will fall back into poverty because, you believe it or not, but diseases like depression, they impact your ability to actually function properly, physically function properly, right? So you fall back into poverty. Then budgetary burden is there. As I told you, it is hardly 0.05% of GDP is being spent on this aspect, the mental health aspect, which is a very, very low percentage. Fine. Impact is this. Then it will lead to isolation, rise of godmen. This is a very dangerous impact. You have seen, I will not take any names, but you have seen how these godmen, in the name of religion, create their own cult. And they have no legitimacy. They are just telling you the things that maybe a therapist will tell you. But because a therapist is a westernized concept and these godmen are smart enough that they are exploiting your vulnerabilities, they will tell you things like, okay, you go and eat this golgappa from this particular shop and you will be okay, right? This is not the solution for any kind of mental health issue. It also leads to abandonment, it leads to sexual abuse, it leads to drug abuse. Sexual abuse, drug abuse, these are very commonly seen in mental health asylums. Okay, so these are very, very problematic. Suicidal tendencies will increase, and overall gendered nature, as we talked about the impact as well. Now, the most important aspect of your answer, which has to be government initiative, because if you do not write this, you will come off as ignorant. Why? Because government is now focusing on mental health, you are supposed to know what they are doing for mental health. You cannot be just suggesting stuff and not knowing what is being done. So the very first thing is Mental Health Care Act 2017. This is a pre-COVID act, but it still mentions, and it still is a separate act, of course, on mental health for promoting the rights of people suffering from mental health issues, right? Mental health issues. So it is a rights based approach. So this is important. Then National Mental Health Program. It is also very important. And National Mental Health Program has one very important aspect, that is community participation. See, it is very, very clear that no one can help you more than your community. If you are having mental health issues, if you share it with your family and they actually understand it and work on it along with you, what better than that, right? What better than that? But those conversations are very, very tough, and they don't happen in our house as much. Then National Institute of Mental Health, and you add mental health and neurosciences, so it becomes NIMHANS. So this has been set up as a proper research-based institute, which is constantly engaging in research in this particular aspect about how to improve mental health. Then Mano Darpan initiative. This is a recent initiative and you need to write about it. It is an initiative by the Ministry of Education. It is by the Ministry of Education, and it focuses on the mental health of the students, the teachers, and the parents as well. Okay, because as you would be knowing that mental health as an issue increases a lot if not addressed properly in the school times. Okay, so Ministry of Education is focusing on the psychological support of students, teachers, and parents, because for mental health even the parents have to be sensitized, right? Then Rights to Persons with Disability Act. Here mental health has been classified as a disability. There are certain mental illnesses that have been classified as disability. Okay, so that is there. Then Kiran helpline is there, and further a few suicide prevention helplines are also there, but Kiran helpline is the Ministry of Social Justice and Welfare. Ministry of Social Justice and and Empowerment. Social Justice and Empowerment. Then there is the Sathi initiative, that's South Asian Mental Health Outreach Program of Asha International. You don't need to write it as much, but you can just know a little bit about it. The Sathi initiative. Okay. Then there is Rah app. What is Rah app? Rah app tells you about the location and contact of mental health professionals around you. Okay, mental health facilities around you, mental health. So Rah means giving path to something. So this app is trying to, if you are stuck in the you know in the dark hole of mental illness, and if you are not able to get that help, Rah app will help you to reach the right kind of professional around you. And there is also the Manas app, where Manas stands for Mental Health and Normalcy Augmentation System, and this is basically a digital well-being program. Digital well-being program. Fine. So just we have like just like we have the Poshan tracker for health, we have Pragati portal for various schemes and tracking them. Similarly, there's the Manas digital program. Okay. So these are the government initiatives. So many government initiatives, still the result has not been seen very openly, because again, it still remains a taboo, right? So we need to give way forward and give very practical way forwards. It has been a trend in UPSC lately that people who are giving practical solutions to problems are ending up gaining more marks. So there is no point of being very idealist. There is no point of being very realist also, that mental health issues are, you know, they need to be tackled in this manner. Never be completely right leaning, never be completely left leaning, never be completely in support of something, never be completely against something, unless it is something like terrorism. Okay, so that is there. So way forward mein one thing is, we can connect the mental health professionals also through Ayushman Bharat Digital Health Mission. What is Ayushman Bharat Digital Health Mission? It is a national health repository of all the healthcare professionals, right? Along with this, it is also the repository of your past healthcare records. So Ayushman Bharat Digital Health Mission should also include the mental health care professionals, right? That is there. Then infrastructure has to be increased. The clinics for psychologists, for therapists, for psychiatrists have to increase. The penetration of mental health awareness and the penetration of gaining solutions for mental health have to increase towards the lower sections, financially lower sections of the society. There needs to be training, there needs to be stress relieving exercises at the level of school, college, and even office. Offices should not be dull spaces like that. Then policy implementation has to be in an effective manner. Decentralized approach should be there. The funding should be increased. Right now, how much it is? Hardly 0.05% of GDP, which is nothing when it comes to the amount of people who are suffering from mental health in India. Community level awareness has to be increased. Drug use, see, drug use and mental health are interrelated. Mental health starts drug use also. The mental health issues, they start drug use. And if you have started drug use just out of curiosity and you get addicted to it, it will gradually develop into mental health issues. That is how your brain functions. Okay, so curbing drug use, then regulating the costs. Just like we were talking about Ayushman Bharat Jan Arogya Yojana, wherein the hospital's costs have to be curbed. Similarly, even here, you cannot be asking 5,000, 6,000, 10,000 rupees per hour as a therapist. How much you might be qualified, right? Digital initiatives and overall availability of the mental health professionals have to be increased. And again, Ayushman Bharat digital health mission can be corroborated in this particular venture. So mental health as a topic, you can expect a separate 10 marker in the upcoming years. Okay, this is something that the government is excessively focusing on since the COVID-19, and any year now a question can come. So you prepare it like a 15 marker question, you will definitely able to be able to tackle the 10 marker. And if it does not come in a separate question, it will definitely be used as a part of your health topic, right? So any which way, mental health is very important, and it's very good that we are discussing in our country about mental health and its implications and overall mental health issues, right? So I know for those who are even slightly aware of their mental health issues might have found this lecture a little empowering also, but a little heavy also, because we don't really talk about mental health. But if you need any kind of health, you can take up the initiatives that I talked about. You can drop in the comments also that in the UPSC journey, what kind of mental health issues you are facing or people around you are facing, because it's all about community building, right, and creating support for each other. So if you are affected by this, you can definitely connect through comments and connect with each other as well. And otherwise, for UPSC perspective, we have done this topic, and I hope you derived some value out of this lecture. That's all for this class, and I will see you all in the next one. Thank you for watching.